So hello guys, welcome to this channel, and in this video I'm going to review a very revolutionary book which has actually changed the way the physiotherapy works in these days, and it has bring a revolutionary change in this physiotherapy world. The name of this book is Manual Therapy, NAGS, SNAGS, MWMs, etc. And the book has been written by Brian R. Mulligan. So those physios who are practicing Mulligan technique must be knowing this book. This is very out of the way book because there are many techniques which has been written and which I have read after reading this book. I got to know about many techniques. So the basically three techniques: NAGS, SNAGS, and MWM. Uh, my teachers used to teach all these techniques in college, and this works amazingly. So if you work for mobilization, so we have different kinds of mobilization like Mulligan mobilization, Maitland mobilization, and Keltenman mobilization, CVX mobilization. So these are the kind of mobilization which us physios should know. But mostly people say we know manual therapy, but they actually don't read it. It's same as if we talk about religion, there are many Hindus, many Muslims, many Christians, but most of them they have not even read their Bible or Quran or Gita. So if you're a physiotherapist and this is a Bible for you, this manual therapy book is a Bible for you because it includes many techniques, and after reading this book you will definitely gonna change the way you treat your patient. Definitely, there's no not even doubt, because it's a practical based book. So once you read the theory, you have some practical, so you can practice side by side after your patient, and you can open the book, you can practice it, open the and practice it. So that's how you the uh, get a hold on this manual technique. So this book combines the mobilization and the active patient movement simultaneously. That is known as movement with mobilization. And it covers all the techniques of your spine, of your peripheral joints, of your soft tissues, and even the simple methods have been given in this book to restore the pain, and it gives the pain relief almost instantly. There are some techniques in the manual therapy like snags or snags. You just have to move it for only 8 repetitions or 6 repetitions. That's it. You are not even allowed to do more than 6 repetitions of that, not even 2 sets. One set, 6 repetition, that's it. You know. So you have to read this book, practice this, and then you can do amazing things. So if you want to know about my story, acha, 3 things which you can learn from this book is, first thing is there are many ways so that you can get pain-free movement is the key. So pain-free movement is the key. So this is the first principle. If it hurts, don't do it. There are 18 principles of manual therapy. This by Brian Mulligan. So whenever you are practicing nags or snags, so if it's even little hurting to the patient, don't do this. So if it's hurting, then you are doing it wrongly. So either your technique is wrong, either your angle is wrong, either your position is wrong. So after correcting any of this, you can get the treatment which you desire for that patient. Okay. Second thing is patient active technique works better. So rather than just mobilizing passively, it also works. Mobilization also works amazingly. I'll talk about mobilization later in some videos. But if you combine the mobilization with active techniques, then it works um, more more nicely. Okay. And third thing is reproducibility and simplicity matters. So this technique is simple, quick, and can be integrated in a daily clinical practice, and it can be done for any thing, for knees, shoulders, spine, neck. Basically people do manual therapy, nags and snags, only for neck pain, but it can also be done on the whole spine if you know how to do it. Because in India or in major colleges, first thing is teachers don't have time, to teach all these techniques, because these are very big technique. And the second thing is students also don't get involved themselves into these techniques. So if you are a good learner and you have a good mentor, you are a good teacher, you have a good teacher, then you can learn these techniques. And then actually you can do miracles. there are many patients in India in physiotherapy only, and many physios also who are struggling, that they are not able to treat their patients. But by God grace, almost I have treated the patients which I have touched, because I know these techniques. I know how to use it, when to use it, when not to use it. These things are very important, and how much to use it. So in this book, it has been written which angle to use, in which angle you have to apply the pressure, how much you have to apply the pressure, how much is your repetition, and why it matters, why only 6, why not 10, why not 20. So after reading this book, you will get to know about this. So my story is, when I was reading this book, uh, I was not confident about the Mulligan technique of the belt, which the belt technique we have in MWM. So that's why I wanted to read this book. But after reading this book, I got better in all these techniques like NAGS, SNAGS. There are other books also by Dr. Deepak Kapri. You can also read it. But this is the original person, Brian R. Mulligan, who has introduced Mulligan therapy to this world, or manual therapy to this world. Okay, to the world of physiotherapy. So after reading this book, I was able to do the belt technique, that Mulligan belt technique, uh, to any joint, because it has been very beautifully demonstrated in this book, and there are diagrams, many diagrams, so that you can follow the diagrams and you can uh, sidewise see your patients. So thank you so much guys for watching these videos. I hope these videos are helping you. Even if you are learning about the books, even if you're not reading the books, you get to know what is inside those books. So you can recommend it to anyone, any physio, if they want to learn. Or if you want to learn, then you can also learn it. I will also try, if you will demand in future, then I'll try to take a class of Mulligan, because I know these techniques. But in India, it's very difficult. They say, "Are you a certified teacher? Are you this? Are you this? Have you got this certification or that certification?" So this makes little things difficult also for a teacher who wants to teach. And it's good also, because there are many fake teachers also. They just learn things and do it. So I support this thing, but it gets little difficult for me also to teach all these techniques, because I approximately know 117 techniques, and I cannot get certified so-called in all these 117 techniques of physiotherapy, and they all are manual therapy techniques. So that's why I teach my students who want to learn from me. It's fine, come and I'll teach you. So thank you so much for watching my videos, and take care. See you in next video. Bye.